Hi, this is Dr. David Zahaluk, and I've got some information that I want to share with you about hypertension. First of all, what is hypertension? Well, the American Heart Association has graded pre-hypertension and hypertension so we can understand the severity of what a blood pressure reading means and help to guide us as to what we should do about it. The ideal blood pressure for an adult is probably about 110 over 70 to 75. That seems to correlate with the least amount of complications from high blood pressure, including heart attack and stroke. Now, arbitrarily, in an otherwise healthy adult, 140 over 90 is thought to be the level at which we call someone hypertensive. But in order to diagnose that, you have to come into the office 3 different times, each time have blood pressure of 140 over 90 for 3 consecutive readings. Now, alternatively, if you come in once and you have a reading of over 160 over 100, that too makes the diagnosis of hypertension. But the JNC, which is the Joint National Committee on Healthcare, has also described something called prehypertension, where if your top number of your blood pressure is between 120 and 139, and your bottom number is between 80 and 89, that's considered to be prehypertension. And a lot of folks who have this, what we used to call borderline, now prehypertension, will go on to develop actual hypertension and need to be on medications. So, what can we do about it? If you have prehypertension, we want you to adhere closely to lifestyle measures. We don't necessarily put patients with prehypertension on medications unless you're a diabetic, in which point we'll put you on medications if you're over 130 over 85. But for an otherwise healthy person, if their range is between 120 to 139 on the top or 80 to 89 on the bottom, we're going to ask you to do 5 things. We're going to ask you to try to reduce weight if you're overweight. That has the strongest amount of reduction in blood pressure. The second is we're going to ask you to try and exercise. And when we say exercise, we mean aerobic exercise, where you're moving constantly, not lifting weights, but doing things like jogging, riding a bike, running or walking on a treadmill, playing tennis, something where you're moving constantly and your heart rate is up. We'll also ask you to watch your salt intake. And for the most part, a no added salt diet is probably enough, unless you have signs of heart failure or what's called left ventricular hypertrophy, which is thickening of the heart wall. Then we'll be a lot more aggressive. But a no added salt diet and avoidance of very salty foods, including peanuts, popcorn, pretzels, and potato chips, is a very good idea. Reduction of caffeine is also important, although it correlates the least with reduction in blood pressure. But if someone's taking an excessive caffeine, coffee, tea, iced tea, certain sodas, then reducing that can be very helpful. Also, those tend to be very high in salt anyway. And the final thing is reduction in excessive alcohol intake. So if you have 3 or more drinks per day on average, that's enough to raise your blood pressure, and if you knock that down to 1 or 2 drinks per day, you'll usually see a favorable effect on blood pressure. So those are the lifestyle measures. And if you're not responding to that and you're going into the hypertensive range, anything higher than 140 over 90, then your doctor will probably prescribe medications for you. Your doctor also, though, will grade your hypertension into grades 1, 2, or 3. Grade 1 hypertension is between 140 and 159 on the top and between 90 and 99 on the bottom. Grade 2 hypertension is between 160 and 179 on the top and 100 and 109 on the bottom. And grade 3 is anything over 180 over 110. And as you can imagine, the higher the blood pressure, the higher the stroke risk and the heart attack risk. Actually, stroke risk has the highest correlation, and at these high levels you may have up to an 8 times increased risk of stroke. Typically, when you're at grade 2 or grade 3 levels of hypertension, you might be on 2 or more medications, and it's just that important to get everything under control. So that's just a brief outline of how we treat hypertension and how we diagnose it. The things that we're trying to prevent in treating your high blood pressure and getting it to an ideal level is prevention of pump failure, because the longer the heart has to push against a lot of resistance, eventually the wall of the left ventricle, the main pumping chamber, thickens, and then it dilates, and then it fails, and then people can develop actual heart failure. It's important to look at the dimensions of the main pumping chamber, the left ventricle, with an echocardiogram from time to time, especially if your blood pressure is poorly controlled. When that wall starts to thicken, if we can aggressively get your blood pressure down, at least to 120/80, we can actually reverse the changes that lead up to heart failure. So that's an important step. The other things that we're trying to prevent with by treating high blood pressure are preventing heart attack and stroke, and you can have up to an 8 times increase in your stroke risk with untreated hypertension, and a 2 to 4 times increased risk in your heart attack, in having a heart attack. But we're also trying to prevent any bleeding in the brain from an aneurysm. We're also trying to prevent kidney damage and kidney failure related to high blood pressure. So a lot of important things. Monitoring and control of blood pressure is a very important part of maintaining a healthy lifestyle, and it's something you should visit with your internist or family doctor about at least once a year, and more frequently if you have abnormalities in your blood pressure. Thank you.